So a lot of talk about Epstein Barr and how it is potentially the most common cause of chronic fatigue and long COVID, and potentially fatigue in elderly. And the next logical question is, okay, let's say we accept what you have to say. Can you actually treat it? And the answer is yes. If you look at all the studies that have been done that show improvement in people who have positive findings for Epstein-Barr, who take different antiviral medications to treat it. There are also supplements that help to augment the benefit of the antiviral treatment to the Epstein-Barr. However, I have to tell you that there are no FDA approved treatments for Epstein-Barr virus, in part because we have not always had the technology to actually sit down and say, okay, how can you measure the activity of Epstein-Barr, and then how can we follow and monitor to see if we are actually making any headway. It's difficult to justify putting anyone on anything for an infection that 98% of people walking around in America today, if they're over the age of 40, will have positive serologies for. So how do you even justify treating someone when 98% of the people have findings of it? And the answer is, well, there are different antibodies available now that we can measure that will give us guidelines as to how active something is, and then we can monitor treatment based on that. And there are also white blood cell parameters and cytokines that you can monitor that will tell you if you are making headway in reducing the load of Epstein-Barr in your body. There are no FDA approved treatments, but there are definitely studies out there that show not only the correlation but also between Epstein-Barr and these conditions, and also responses to treatment for those who take antivirals and supplements for Epstein-Barr.